are wrapping up your lunch, in the room next door is going to be special needs training with Logan Phillips. And in this room, I'm excited to introduce Kevin from Disability Rights Ohio. He is going to be talking to you guys about waiting list system for the Waiver program. So, Kevin, take it away.
Hi everyone, how's everyone doing? Can you hear me? Can you hear me?
Yes.
Yes. Okay. I can hear myself. Okay. As she said, my name is Kevin Truitt. I'm the Legal Advocacy Director at Disability Rights Ohio. And I'm here to talk to you all this afternoon about waiver programs and waiting lists for waiver programs. So I have a PowerPoint here. You can follow along. Feel free to raise your hand or shout out if you have a question or a comment or want to talk about something specific. We can also, I have time at the end to invite questions from you all. I want this to be more of a dialogue, a discussion, instead of me just talking the entire time. So, waiting lists for waiver programs in the state of Ohio. So I want to give you a brief introduction about the organization where I work, Disability Rights Ohio. So we're a nonprofit civil rights organization for people with disabilities. We're a statewide organization, so we work for people all across the state of Ohio. We're known as the Protection and Advocacy System. So every state and every territory in the country has a protection and advocacy system for people with disabilities to advocate for their rights and provide individual advocacy, systemic advocacy, those types of things. So we are Ohio's protection and advocacy system. Our mission is to advocate for the human, civil, and legal rights of people with disabilities in Ohio. And our vision is one in which people with disabilities are full and equal members of our communities, enjoy the rights of and opportunities available to all people, can make decisions about how, where, and with whom they will live, learn, and play, have access to needed services and programs, and are free from abuse, neglect, exploitation, and discrimination. So that's our vision, that guides our work, and we're very passionate about our jobs and our advocacy for people with disabilities. So I've already mentioned this, that Disability Rights Ohio is Ohio's protection and advocacy system. We get federal grants to do our work. I think we have 9 or 10 federal grants now. One of those grants funds our advocacy for people with developmental disabilities. That's called our PAD grant, P-A-D-D. And the governor of each state or territory will designate the entity that is the protection and advocacy system. So the governor in Ohio said Disability Rights Ohio should be the protection and advocacy system. So that's kind of how the system works. There's a really long history, which I could talk about for a long time, about how P&As came into existence. So we've been around for a long time. We actually used to be called, before we were called Disability Rights Ohio, we used to be called Ohio Legal Rights Service. I don't know if anyone's ever heard of that organization. Until about 10 years ago, we became Disability Rights Ohio. So when we were Ohio Legal Rights Service, we were a state agency, had a different name, and mostly the same organization, but those were two differences. But we started off in the 70s. There was a really terrible institution in the state of New York called Willowbrook, and some of you may have heard of this. It was a huge scandal back then. It was exposed by media coverage where this massive institution that was only, I think, I don't know the numbers off the top of my head, but it was only meant to serve a few thousand people, and it ended up, there were like 6,000 or 7,000 people who lived in this institution, and it only had the capacity to serve like half or a third of that. And people were in really terrible conditions, a lot of abuse and neglect, and it was this huge scandal, like I said. And so Congress created the protection and advocacy system to fight for the rights of people with disabilities in institutional settings, like that type of institution, but also people who live in the community and are seeking services and need our advocacy. So that's just some history about Disability Rights Ohio. So we are a client-directed organization. So if someone contacts us, a person with a disability, they are our client, and we listen to them and we take direction from them. So a family member or a friend or another advocate could contact us on behalf of that person with a disability, but we're always going to take direction from that person who has a disability. Even if a family member wants to be involved, that's totally cool. There may be some disagreements where if there is a disagreement, we're going to side with the person with a disability. Not that if there are disagreements, which happens in life, right? Like it's often well-intentioned, but that's our philosophy as an organization is person with a disability is our client, and we're going to listen to them and we're going to fight for what they want us to do, if that makes sense. We keep everything confidential, so if someone contacts us and has a question about waiver programs or needs help navigating the waiver waiting list system, we're going to keep that confidential unless the person gives us consent. You can reach out to the county DD board, or you can reach out to this provider on my behalf. But otherwise, we're going to keep everything confidential, so you can trust that will happen. And like I said earlier, we do a mix of individual and systemic advocacy. So what that means is a person can contact us and say, hey, I really need services or supports. I need to enroll in a waiver program. Can you help me? And we can give advice, we can give guidance on their situation and try to help that person on an individual level. But we also do more systemic work and try to change systems so they work for all people across the state, if that makes sense. That's what we mean by systemic advocacy. So here is our contact information. If you need a question answered or advocacy for your situation, I should say I can't promise that we can necessarily help every single person who contacts us. We're a small nonprofit located here in Columbus, and like I said before, we represent people across the state, and that's literally millions of people with disabilities, and we just don't have the capacity to help everyone. But at the very least, we can give you resources, give you advice, and at least point you in the right direction so you can advocate for yourselves, if that makes sense. So we have different ways to contact us. We have a phone number, we have a web intake form on our website. You can write us a letter too, and our address is there. So, to get to the main part of my presentation, I want to talk to you all about waiver programs in Ohio. I'm assuming you all have heard about waiver programs, right? Okay. So there are a lot of different waiver programs in Ohio. There are 3 waiver programs for the developmental disability system, and they're listed up here. So the individual options waiver, the level 1 waiver, and the self waiver. Those are 3 different waiver programs in Ohio. And each of them have different types of covered services and supports that are available for people who are enrolled in these programs. So the individual options waiver is probably the most popular waiver program just because it has the most funding available for people. There are no funding caps for people enrolled in the individual options waiver, whereas for the level 1 and the self waiver, there are funding limitations. So the individual options waiver, like I said, is the most popular, especially for people who have a lot of needs. So waiver programs have been around for a few decades, and they're very popular programs. They're alternatives to institutional care. So before waiver programs existed, if you didn't have support from family or friends, most people had to go into a facility or an institution to get the supports they need. And so waiver programs have been developed over the years to serve people so they can live in their own homes, live with their families, live with roommates, live in small group homes, in their own communities instead of being isolated in a facility or an institution. So again, very popular programs. We get a lot of calls from people who have questions, how do these waiver programs work, or how can I enroll in a waiver program? So for as long as I've been doing this work, there have been waiting lists for waiver programs because they're so popular, right? And so until I think it was 2018 when the system pretty dramatically changed. And before that time, it used to be the waiting list would be ordered based on whenever you asked for a waiver. So if you asked for a waiver in like the 90s, which I remember having cases where people asked for a waiver in the 90s and they were still on a waiting list. If you asked for a waiver in the 90s, you would be in front of someone who asked for a waiver more recently. So it was based on date of request. And so that created some inequities, like wonder if someone asked for a waiver a really long time ago, but doesn't really need one right now, but there's someone who asked for one more recently, but they like urgently need services, right? So that was kind of the motivation behind creating this new waiver waiting list system, which is based on assessments, okay? So now if you want a waiver, and waiting lists are structured or ordered based on the county in which you live. And so every county, you probably know this, has a county board of developmental disabilities, which oversees that county, oversees the waiver programs in that county for people with developmental disabilities. So if you need a waiver, you live in Franklin County, for example, you can ask for what's called a waiver waiting list assessment, okay? And that's an assessment to determine what are your needs right now, why do you need a waiver, and how soon do you need one? Whereas before, if you remember, before this waiver waiting list assessment process was put into place in 2018, it was based on when you requested, and it was ordered that way. So now, like I said, you ask for an assessment, and the county board, the county DD board will do an assessment and determine what your needs are and how soon you need a waiver. And then that will determine, are you gonna get a waiver now? Are you gonna go on a waiting list? Or are you gonna get neither? And I'm gonna go through that too. So, as I said, waiting lists exist because waivers are so popular and the demand for waivers just exceeds the number of waiver slots that are available across the state. There's a certain number of waiver slots for each of those 3 waiver programs. And the demand just exceeds those numbers. So that's why we have waiting lists. Not every county is going to have waiting lists though, which is interesting because we live in a state where it's a county-based system. And so some counties just have more money, more resources to enroll people in waiver programs. So we see a lot of those geographical disparities where if you live in a county with fewer resources or less money, then you're more likely to go on a waiting list or more likely to not get a waiver for a while. Whereas if you're in a county like Franklin County or Hamilton or Cuyahoga, you're more likely to get a waiver. You're more likely to not be on a waiting list. That makes sense. So, yes, so the current system, as I said, a county board will do an assessment for any person who says, I want a waiver, please enroll me in a waiver program. And so the way that the assessments are structured, as I said, is going to determine whether you get a waiver now or whether you get placed on a waiting list or whether you neither get a waiver nor get placed on a waiting list. So let's see here. So when you ask for a waiver waiting list assessment, you ask your county DD board, you can contact your county DD board and say, I need a waiver program, I'm not enrolled in a waiver program, but I need services and supports. Or it could be that you're on the level 1 waiver or the self waiver, and you say, I need more funding, and I'm not getting enough services, I need the individual options waiver, which if you remember, that just has more funding and more services for people. So you can ask for that waiver waiting list to the county DD board, and they have to start the waiver waiting list assessment within 30 days of your request. That's what the law says, okay? And it could be that you're in an emergency situation and you need services right now or bad things are gonna happen to you, which we see that every once in a while. So you could ask the county DD board, hey, I need you to do this assessment much sooner than 30 days from now. That's something that you can ask the county board to do. Not necessarily, it's not guaranteed that they will comply with that request, but you could at least make that request. You also have a right to a copy of the assessment once they're finished with it, so you can determine, are they right, are they wrong, is this something that I can challenge, which I'm going to talk about that too. So the waiver rating list assessment, as that third bullet point says, is first going to say, does this person even have a developmental disability? That's like the threshold question. If a person doesn't have a developmental disability, then they'll say, you should seek a waiver program in a different system or services and supports in a different system. So they first have to determine that you have a developmental disability. And then the second part, which is most of the assessment, is, like I said, what are your needs? Do you have what the system calls immediate needs, or do you have current needs? And I'll go through what that means. So immediate needs feels like a pretty serious emergency. So the way it's defined is immediate need is a situation that creates a risk of substantial harm to an individual, so an individual who needs a waiver, or their caregiver, like a family member, or another person. It creates that risk of substantial harm if nothing is done within 30 days. So that's immediate need, and I would say that's an emergency. It's an urgent situation, right? And so there's these different, that's really tiny, I'm sorry. There's different examples of immediate need under the law that would qualify as immediate need. So if you're a resident of an ICF, an intermediate care facility, and you received a notice of discharge, if they say, we're kicking you out of this facility, you need to go, then you could ask for a waiver waiting list assessment, and the county board would have to determine what to do from there, like enroll you in a waiver program and connect you to providers and housing. So that could be an immediate need situation. If you're in a nursing home and you get a similar type of notice that says you have to leave, that could be another immediate need situation. Another example, you're an adult, you're losing your primary caregiver due to unforeseen circumstances. Say, for example, you live with your parents, or you live with one parent, and that parent becomes sick or unable to care for you, or passes away tragically. Then that would be a really strong argument for an immediate need if that situation happened. You have documented behaviors that have been determined to put yourself or others at risk of harm. That's actually the most common reason why someone has immediate needs. They have documented behaviors. The fourth one is significant care needs or life-threatening medical needs. And then the last one is you are an adult and you have been subjected to abuse, neglect, or exploitation. So those are the different categories for immediate need. And if the waiver waiting list assessment says you fit one of those categories, or you meet that definition for immediate needs, that makes it much more likely that you're going to get a waiver, okay? If you meet that immediate needs criteria. So, so current needs is something that's not quite immediate. I don't know why they call it current needs, because it feels immediate and current feels similar. But so current needs is not quite as urgent as immediate. That's just what they call it, current needs. And so current needs is, I'm sorry, this is so small. An unmet need for waiver services within the next year, within 12 months. So not urgent, but still within the next year, within the next 12 months, you will have a need for services. So immediate needs is urgent, current needs is within the next 12 months, okay? And then the law gives several examples of what qualifies as current needs. So your primary caregiver has declining or chronic physical or psychiatric condition that limits their ability to care for you. So that could be an example of a current need. And there aren't other caregivers that could step up and provide support to you. And that means that you're likely to be at risk of substantial harm, so that's current needs. Another example of a current need, you have ongoing need for limited support for your behavioral, physical, or medical needs in order to help your current caregivers and to help you stay in your home. Another example is you have an ongoing need for support for significant behavioral, physical, or medical needs. You're aging out of the foster care system. You're becoming an adult, and you no longer have access to services in that system. You need funding for adult day services or employment services, or you're living in an ICF or nursing home and you want to move out. So those are categories under the current need category. Again, less urgent, but still within the next year you're going to need services, okay? So if you have current needs, you're not going to get a waiver immediately, you're going to go on a waiting list, but often it depends on what county you're in, because that waiting list may move a lot more quickly in some counties compared to other counties, right? And so, yeah, there's those geographical disparities, which is not good, but it depends where you live. That determines whether you get services or not. So that's one problem with the system. So those are the two major, keep going backwards. Those are the two major categories under the waiver waiting list assessment. Do you have a question?
When do you want questions? Do you want them now when you're talking, or do you want them at the end?
Whatever.
Okay.
You want me to go back?
Yeah, go back a screen. Go back. Okay, your primary caregiver. Okay, go back to the one where it says your primary caregiver. Your primary caregiver is declining or chronic. Okay. What do you consider voluntary and voluntary care?
Good question. Can I come back to that?
Yes, you can. Go right ahead.
Let's talk about it now, actually. So, I don't know if you've ever heard of a concept called natural supports.
Yeah.
Yes.
Which actually ends at the age of 18.
It's what?
It technically ends at the age of 18. I'm no longer a voluntary support.
Yes. So, when you are an adult, when you're 18 years old or older, you're an adult legally, right?
Correct.
And so, when you're a minor, when you're a child, your parents have certain obligations to you.
Legal rights,
because
right?
You're a child, right? That's just the way our society works. But when you're an adult, the system can't say to a family member, a parent, a friend, you have to provide services and supports to that person, and they're going to be unpaid, and you're not going to be compensated. So those cannot, by law, those cannot be coerced. Natural supports cannot be coerced. So if they're saying you don't need a waiver because you're an adult,
exactly,
and you have your mother,
or you're going on the level 1 or the self waiver because hey, you've got natural support at your house. You don't need the IO waiver because you have natural support, a voluntary support. My child is way over the age of 18. I am not going to be his voluntary support.
Yes. So I'm really glad you brought that up because we see this a lot. A lot of families,
yes, we do.
A lot of parents, the system relies on them to provide care for people instead of providing them a waiver, right? And so I'm sure many of you have experienced this, caregiver burnout, caregiver fatigue, right? It's because the system puts so much pressure on families and parents to support their loved ones when they should be enrolled in a waiver program, right?
Correct.
So a county duty board could not say, if an adult is living with his or her mother, and the mother is like, I'm exhausted and I should not be forced to provide care and supervision or support to my son or daughter, that would not be a legitimate reason for them to deny that person a waiver. Does that make sense?
It is,
but
it's used all the time.
All the time.
All the time.
So there are ways to challenge that, which I'll get into. It's unfortunate that you have to challenge it, but there are ways to challenge it.
Okay.
So those are the two, well, I guess there are three outcomes. Immediate needs, current needs, or neither, no needs, okay? So, if you have an immediate need, again, sorry I'm being repetitive, but that's an urgent need, it's almost like an emergency if something isn't done soon, right? If you have an immediate need, then the county board is obligated to do something to make sure those needs are met, okay? So now it turns into, yes, we've acknowledged you have immediate needs, but what's the solution to that? So the solution could be the county board decides we're going to enroll you in a waiver program, the individual options waiver program, for example, which is, in most circumstances, going to be the best scenario, right? the county board could say, you have an immediate need, but we're gonna enroll you in the level 1 or self waiver, which is gonna be an improvement from having nothing, but may not be the ideal solution, right? Or the county board could say, you have immediate needs, but we're not gonna give you a waiver. We have this other plan, what are called alternative services, which could mean a lot of different things. So that could be another solution proposed by the county board to your immediate needs, which we'll get into how you can challenge that, okay, in a few slides. So if you get an immediate needs determination, that's a very good thing, but it's not the end of the road, okay? You still have to show you need a particular waiver program to meet those immediate needs. So if you have current needs, the county board could say, we're gonna put you on a waiting list for a waiver. We're not gonna give you a waiver right now, but we're gonna put you on a waiting list. Or you don't even need to go on a waiting list for a waiver. We have these alternative services, which that could mean a lot of different things depending on the circumstances. Or if you have neither immediate needs nor current needs, then you basically get nothing, okay? You're not gonna get a waiver, you're not gonna be put on a waiting list at all. Maybe they'll help to direct you to other resources or information, but generally, no needs means you're not really getting anything. So county boards, once they do the waiver waiting list assessment process, you have a right to a copy of it, and you have a right to challenge the decision that they made through this assessment. So that could mean a lot of different things. If the assessment comes back and it says, you don't have immediate needs, you have current needs, you could say, I want to challenge that. I want to go to a hearing. It's called a due process hearing or a Medicaid hearing. I don't agree with that determination. I think I have immediate needs, so I'm going to challenge that decision. Or a county board could say, you don't have immediate needs or current needs. I want to challenge that because I don't agree with that. There's so many different things you could challenge. So you could get an immediate needs determination, but they say, we're not giving you a waiver, or we're giving you a level 1 waiver instead of an individual option waiver. You could challenge that. So if you're unhappy with any part of the assessment, if you're not getting what you think you need, then you can challenge it, okay? Yeah.
Okay, so we can challenge this assessment. Can we challenge the ODDP?
Okay, good question. I should give you the microphone when you do that. So
That's okay.
The ODDP, Ohio Developmental Disabilities Profile, technically separate from the waiver waiting list assessment process. It's weird how this works, but so the ODDP determines whether you're eligible for county DD board services, which are basically non-Medicaid, non-waiver services, okay? And then, but the waiver waiting list assessment determines whether you're eligible for, or whether you're gonna get a Medicaid waiver. So they're technically two different things, but there's a lot of overlap. So the ODDP is going to determine, do you have a developmental disability? Can the county DD board serve you as a client? Okay? So if you're not eligible for county DD board services through the ODDP, then the waiver waiting list is probably going to make the same conclusion and say, you don't have a developmental disability, we're not even going to do the assessment. Does that make sense?
But you are eligible on the ODDP, but because of the way it's split up, you're put down here on the bottom of how many services you get, where you should be maybe at level 6 or 7, and you needn't. Yeah, so they're agreeing with me.
You have no entitlement to any services if you're only eligible through the ODDP. A county board could say, yes, you're eligible for services, but we don't have funding for you. We don't have any services we can provide you.
Okay, so like in my case, I have a level 2. I think he's a level 3, level 4. I think he's a little bit higher than he is. I'm not saying he's up here, but I have friends that are up here in the 7 and 8, but they're still down here on it too. And those are the ones that we need to help.
Yeah.
We need to get them up where they need to be, where they're, full care kids are getting a level 2. They need to be a level 7.
If they're home, they're level 2.
Yeah, exactly. So they're home, they're with their natural voluntary support. So how do we fight this? Where do we go? How do we get the board so that, yes, you're right, this ODDP is crappy, you're at the wrong level, you need to be up here.
Okay, I'm sorry. I was talking about the OED. I was talking about the OED process, which is different. I'm sorry. forget everything that I said in the last 5 minutes. So the ODDP,
The high profile,
so
yeah.
that's for the individual options waiver. I'm very sorry.
Yes.
So that's getting ahead to, you went through the waiver waiting list assessment process, and you're on an individual option.
We are on
right?
IO, yes, we're on all on IOs.
So the ODDP is going to determine your funding levels once you're already on the IO waiver. The
Okay,
individual
but
option
everybody is thrown onto a level 2 if you're if you're voluntary
waiver.
parents in your
So
home.
that's a second assessment, the ODDP. That determines your funding levels. So it goes up to 7, right?
I think it goes up to 8, but yeah.
9. I thought
So-
it's 9.
9 was an exception. There's an exception rule to it. Most of it's 7 or 8, but there is an exception on 9, and that's, I forget what it is, but there is an exception for
But
a
the
9.
issue is that if they weren't home, they could be an 8, because that's how high their needs are.
Yeah.
And once they're home, they're a 2.
Yeah.
If she come over to my house and she took care of my son, she'd be getting twice what I get, at least.
Yeah. So what we're talking about now is you've already been through the waiver waiting list assessment process. You have the individual options waiver. Now you're fighting for the right level of funding
Correct.
and services. And so the ODDP, a separate assessment from the waiver waiting list assessment, which determines whether you get a waiver and which one. This is determining what services you get and how
What
much
level
money.
of care.
So the ODDP is a list of different questions. I haven't looked at it in a while, but like, what's your disability? Where do you live? Do you have natural supports? Do you live with your
Natural
family?
support is the
Do
one.
you have behavioral needs? Do you have medical needs? And then it will produce a funding range. And so there are 8, I think you're right, 8 different funding ranges through the ODDP. And then that determines the level of money you're getting through the individual options waivers. But there's ways to challenge that too. So
That's what we want to know. How do we
okay,
challenge
so
it?
there's a process called prior authorization, which if you go through the ODDP and it gives you a funding range and you say that's not close to enough services for myself or my loved one, I want to ask the state to authorize more services above that funding range. You can do that. And sometimes it's approved, sometimes it's not. If it's not approved, you can challenge it. You can say, my son or daughter or myself, I need more services. This funding range is not accurate. It's not going to meet my needs. And so, does that make sense what I'm saying? So you're asking for.
So I've heard of prior authorization for like if I need more mileage or if I have extra, but I was told I could not challenge this level with a prior authorization.
That's
Now
not
you're
accurate.
saying I can.
You can, absolutely. Yeah.
Just a quick question to back up. Is the ODDP just for the IO waiver? Is that
Yes.
right? Okay, so
Yes.
my daughter's on a self-waiver, and I think she needs an IO waiver.
Okay, so ODDP wouldn't apply there because, like I said, it only applies to the individual options waiver. So that's when you would back up and say, I need to go through the waiver waiting list assessment process because I need the individual options waiver.
Okay.
Because the self-waiver has a cap on services, I can't exceed that cap. And so I need more services, I need more funding, so I need to be on a different waiver program, which is the individual options waiver. And so then you have to, and then the analysis is, do you have an immediate need, even being on the self-waiver, do you have an immediate need, or do you have a current need, or do you have no needs because you're already getting the self-waiver? And so if you have immediate needs, then more likely to get the individual options waiver. If you have a current need, you're going to go on the waiting list likely. If they say you have no needs, your self-waiver is meeting all of your needs, then you're going to stay on the self-waiver. Does that make sense?
Yeah, what does that waiting list timeframe kind of look like? If it's more of a current need, because I know I can justify that.
It really varies by county. I don't know where things are, and I don't know if you all are in Franklin County or. Last I heard, and this was a while ago, Cuyahoga did not have a waiting list. So if you are placed on a waiting list, you're basically not placed on a waiting list. If that makes sense. But so I don't know how soon that person would get a waiver. It really depends on the county, and there are a lot of variables there. I'm sorry that I thought you were talking about OEDs. My brain was not working. So OEDs is a different topic. I'm glad that, thank you for correcting. Does that make sense? Do people have more questions about the OPP? That's
Okay.
like the next step after the assessment process.
Okay, so if I want to fight this, do I just write a letter to the board, or?
You should talk to, so if you're on the individual options waiver.
I mean, you
you're
go to your
not having-
SSA, but this is above her level, so you just go ahead to the superintendent and say, hey, this is what I want to do a prior authorization, I want you to review this, these are his needs, this is.
Yes, it's disappointing to hear that the SSA is not helping you with that request for.
Well, SSAs can't really help you because they are answerable to their superintendent, and so this is all over
They're
their heads.
obligated to help you with the request for prior authorization.
Okay, just
if
have
you
them-
need to go above their head and ask for their supervisor.
Okay, so just ask my SSA, tell you this is what I want, okay?
So yeah, you can see how this system is just so complex and there are so many different layers and levels to this. And sometimes when you're on a waiver, sometimes you need to back up and say, I need to start the assessment process over because the waiver I'm currently on just isn't what I need. I need the individual options waiver. So thank you for that question. That was a really good question. So I think what was I talking about? So all the different outcomes after the assessment is completed, if you're not happy with it, you can challenge it, and you can go to a Medicaid hearing and present arguments to a hearing officer. It kind of sounds intimidating, but it's not. It's not like being in a courtroom with a judge and a jury and all that. You're basically in a room with a hearing officer, and then there's someone from the county board there. And
They're
they'll
generally,
present their case,
aren't they
and then
generally over the phone?
sometimes it's over the phone, sometimes it's on
Yeah.
video. And then you basically say, depending on what the issue is, went through the waiver waiting list assessment process, and I need a waiver, I'm not getting a waiver. I was found not to have immediate needs, or I was found to have immediate needs, but I'm only getting a level 1 waiver. And then you present evidence. You can bring people to testify, you can bring documentation, you can bring, if you have, I mentioned earlier that documented behaviors is the most common reason why people have immediate needs. You can, if you keep good documentation on like problematic behaviors, that's something you can present to the hearing officer. So there are ways to challenge the assessment outcome if you're not happy with it. Yes?
Just to clarify, if you're a provider, you have no standing. As a guardian,
Correct.
as a mom, you can help. But as a provider, they won't even give you the time of day.
Correct.
No standing.
So in other words, you have to go and say in the best interest of my child, and use those
Because
terms,
as a mother-
use their terms to them.
Yes. But a provider could be a witness, could testify, could help you prepare for the hearing.
I had our county board told me that even though I was a provider and a mom, I had to become her guardian to be able to challenge anything. And legal aid helped them understand otherwise.
Okay, that's interesting.
Yeah, it was ridiculous.
So yes, it's good to know that you have. It's good to know that you have rights. If the assessment process does not come out the way that you had hoped, you have rights to challenge it, and they need to give you notice explaining how you request that hearing. And you can always contact us, and we can give you guidance. Like this is your situation. These are the arguments you should make. These are the witnesses you should bring to the hearing. These are the documents you should bring. Things like that. Not everyone is going to have problems. Like some people will get a waiver, some people will go on a waiting list and they're okay with that. But again, it's good to know that you have rights to challenge decisions that you disagree with. So we've been talking about one part of the system so far, the waiver waiting list assessment process. There are also waivers, they're individual options waivers, but they're state funded, so you don't have to go through the waiver waiting list assessment process. Again, state funded waivers. The other waivers, the waivers that I've been talking about, are funded partially by county deed boards, which that's an interesting conversation because that's what creates the geographical disparities, right? Because county boards are financially obligated to pay for part of the waiver, and so when they're making decisions about who goes on a waiver, there's like that financial conflict of interest, right? So these state-funded waivers are actually, in my opinion, a better model because there's not that conflict of interest. And so these state-funded waivers, may have heard about our Ball versus DeWine lawsuit that we recently settled a few years ago. We brought back in 2016. So that case was about people who are stuck in facilities, intermediate care facilities, stuck on waiting lists, and they're in institutions, facilities for years or decades, and languish on waiting lists. So that lawsuit was meant to solve that part of the system. So now these state-funded waivers are available for any person in an intermediate care facility, residential facility, who wants to move out and who wants to enroll in an individual options waiver, which is really cool. It's also for people who are, say they, and this is an interesting scenario, but say they have like an immediate need situation, and they're like, if this is such an emergency that I need to go into a residential facility or an institution, the county DD boards are now required to offer people a state-funded individual options waiver if they're like applying for admission to an intermediate care facility. So if you're in that bad of a situation where you have to like leave your home or leave your family's home and go into an institution, then you're going to have access to one of these state-funded waivers, which is a good thing. And then we've been working with the Ohio Department of Developmental Disabilities. A lot of people, I'll get to you in a second. A lot of people with developmental disabilities, primarily people who also have like complex medical conditions, who are in nursing homes, and they often get stuck. And so we worked with the state to allow access to state-funded waivers for that population. You've probably heard that during the pandemic, there's just been huge numbers of COVID infections and fatalities due to COVID from people in nursing homes. So getting people out of those congregate care facilities where it's harder to socially distance and the virus spreads more quickly and a lot of people get sick and die. It's very sad. So how can we get people into their own homes, into their own communities where people generally are happier and have a higher quality of life? So those are state-funded waivers. Just wanted to mention that. It's different from the waiver waiting list assessment process, but still waivers available for people in certain situations, people in ICS, people in nursing homes. Yes?
Just out of curiosity, like when you're talking about state-funded waivers, I'm assuming you're talking like long-term care waivers, AL waivers, Ohio home care waiver.
So those are
like Ohio Home Choice when you're transitioning from a facility back out to home and community-based services. How hard is it to switch from a state-funded waiver back onto a state waiver?
Okay, so you were asking about, I'm just going to repeat your question, which I should have been doing before. You're asking about different types of waiver programs. Those are the Ohio Home Care Waiver, Assisted Living Waiver, Passport, My Care Ohio.
Yes.
Those are waiver programs, but those are for different populations, different disability populations. And so if you don't have a developmental disability, but you have a complex medical condition, you can enroll in the Ohio Home Care Waiver program. If you're under age 60, if you're over age 60, you can enroll in Passport. And so those are state-funded waivers for different disability populations. These are the state-funded waivers that I'm talking about. They're within the developmental disability system.
Okay.
They're individual options waivers. They're just for different situations. Does that make sense? Yeah. So it's hard to move from one system to the other. If you have a developmental disability, then you're in the developmental disability system. If you're not, then you're in this other system, whether it's the aging system or, depending on your age, or like the Ohio Home Care Waiver you mentioned. That makes sense. So I feel obligated to mention, I'm sure a lot of you have heard of this or experienced this. Do you have another question?
What would the new Ohio RISE waiver system, what did that fall under?
So, very good question. She asked about the Ohio RISE new, let's call it a Medicaid managed care program for kids with behavioral health needs. So that's a new, and there's a subset of this new program that will have a waiver program. Ohio RISE itself isn't a waiver program, but it will have a waiver program for kids who meet certain criteria, and I don't have that off the top of my head. But so that's a different system, but there's going to be a lot of overlap with kids who have behavioral health needs, and also they have behavioral health needs because they have a developmental disability. And so that's one of the things that we're going to be monitoring is, so the Ohio Eyes program begins, I think, a week from today, July 1st.
July.
And so how is this going to work? I don't know, to be honest with you, and that's something we're going to be monitoring. If you're a kid, you have a developmental disability, and you have behavioral health needs, do you go to a county PD board for a waiver, or do you go to Ohio Rise for services through that program, or waiver through that program? I honestly don't know. And how those systems coordinate with each other and communicate with each other is going to be really important. That's a very good question, and I'm very curious myself. I'm glad you brought that up. Thank you. Yes?
What should parents do if they have applied for a DD waiver and they have been told that they should really get an Ohio home care waiver because the child is so complex medically, and then the Ohio home care waiver people say this person should have a DD waiver because they're developmentally delayed, and they're both.
Yes.
What does a parent do?
Yes. So you can only be eligible. So this person is asking, they're applying for the Ohio home care waiver and being told not eligible for that program, you should apply for a DD waiver, or the DD waiver is saying you should apply for the Ohio home care waiver. I've seen that so many times over my career, and it's so frustrating because you can only be eligible for one, you can't be eligible for two at the same time. And so what are you supposed to do? I would contact us about an issue like that because it's two systems like pointing their fingers at each other and saying, I'm not responsible, they are, right? And then you just get stuck in the middle. You could challenge each decision, but it's like, who wants to, I mean, who wants to go through two hearing processes? It creates a mess for people, and it's a problem that we've seen over the years. And I mean, I could maybe, if I knew more about the case, like make my own assessment. I think they're probably eligible for this waiver, not that waiver. But it's kind of a risk. Like, if you take this to a hearing officer, is the hearing officer going to agree with you? You know, so it's very complex, and it's not good that the system works that way. I've seen that many times, though, unfortunately. So the workforce crisis. I feel obligated to talk about this. Okay, 8 minutes left. The workforce crisis, so a lot of people out there who need waiver services and maybe already enrolled in a waiver program, and have been authorized services, have the funding they need, but just can't find a provider. And there's so many people across the state are just really struggling right now because of this workforce crisis. So it was a crisis before the pandemic, and now it's, I don't even know, but we're worse than crisis, but Armageddon, I don't know. So things are really bad there. A lot of people struggling to find providers. A lot of families are exhausted, and some people are being forced into facilities, nursing homes, or institutions. Some people are just like really struggling. I've heard horror stories of people like sleeping in their wheelchairs at night because they can't find a provider, or like not eating granola bars because they don't have the ability to like prepare food or meals. So things are really bad out there for a lot of people. And so getting a waiver these days is not going to guarantee that you get services, unfortunately, because of this workforce crisis, because our state, our legislature just does not invest in this workforce. And so a lot of workers out there, I think the average wages are about $12 or $13 an hour without like no guarantee of health insurance or sick pay or vacation time, or so the workforce is like on the verge of collapse, and we're really pushing hard for the legislature to put more money into the system so wages can be increased and we can start to build up this workforce, this system, so people can not only have access to waivers and funding, but actually services and providers. Yeah.
That was kind of why I asked the question with DODD in regards to whether with Appendix K, with the emergency funding, they allowed parent caregivers to be paid because of the workforce crisis.
Yeah.
So, I mean, like, yeah, we're pretty strong advocates knowing that there's no staff out there who can help us with our kids.
I think Appendix K, it did a number of things.
There were some permanent changes made, like with the
Yeah.
additional funding to 30,000, but like the biggest one all of us are wanting to know is whether they're gonna make a permanent change that caregivers can be paid providers, which is an actual thing in other states.
Yeah.
So it's not too far-fetched of a request, knowing that we're in a.
Yeah. If you can't find an outside provider, but you have a family member to provide you care, like that family member, especially when the person is an adult and natural supports are applicable, right? Like that family caregiver should be compensated. Because there aren't many people in the world that can have a full-time job and also care for a loved one who has pretty extensive needs, right? So if that's the situation, like that person needs to be compensated. That person has bills, rent, mortgages, right? Like food,
Car repairs.
utilities. So I totally agree with you. The system needs to recognize that these are problems and people are suffering, and I agree with you. There needs to be more flexibility and more compensation for family caregivers for sure. Yes.
Okay, if the state is not investing enough in the caregivers, in this direct service professional, so then you have these authorizations, but you can't find help.
Yep.
So then you're not billing the state, of course, they're saving money because you don't have providers. So what role is DRO gonna look at for that? Because,
Yeah.
you're being told you're gonna have services, but since you're paying them nothing, no one was working, so then it's the state saving money and
Yeah.
people are not getting care and.
I hear you. Yeah. So the system is funded by our legislature. They control the funding, and so that is our target now. How can we convince legislators to invest in the system, to give more money to the system so we can pay workers more? Because right now, people can go work at like Wendy's
Yes.
or fast food and make more money. When this work that we're talking about now is so important,
So
so
is
critical.
DRO addressing the fact that, if they don't invest, then people just aren't getting services and
Yeah.
they really haven't lost anything because they just don't have to pay?
Yeah.
You follow me? So-
Yes, I hear it. I hear you. So that's part of our messaging is, the system is not working. The system is failing a lot of people
I'm just glad you're-
because the people in power who have the power to fix this crisis, we don't have their attention yet. We want to change that.
That's what I want to know.
So if you're interested in being part of, we're trying to get people engaged and people who are directly impacted by this crisis, or family members, parents, providers. Reach out to us if you want to be engaged, because we're trying to develop this campaign where we're putting pressure on the legislators who have the power to fix this. Because when they hear stories about people who are directly impacted by this, that's the pressure we want to put on people in power to fix this, So reach out to us if you want to be involved. Yes, sir? I had a feeling I would get that question.
I didn't hear that.
If you have a
Oh, I'm
level
sorry.
1 waiver, what can you use that money for?
Oh.
That money all goes into one pot now, and they can break
Yeah,
it.
and the level 1 waiver has pretty low funding caps, so it does give you like a
It's
minimum.
35 if you're in school and 40
That's
if
the
you're out,
waiver.
as of July 1st.
Did it
No,
change?
as of July
Okay.
1st, they're both the same waiver. Both the same equal
Really?
funding, yeah.
45.
Huh? 45 for it all?
45 for adults.
Yeah, I knew it somewhere around there.
Okay, yes, okay, I remember that. So level 1 waiver, I print these things with such small font. So there's a number of different types of services covered by the level 1 waiver. Homemaker personal care services, which is like helping with
HPC, yeah.
HPC, like getting dressed, bathing, toileting, meal preparation, eating, things like that. Remote support, which is like remote monitoring, basically like a camera in your home to make sure you're safe, which some people choose that option, a lot of people don't feel comfortable with it. Home delivered meals, non-medical transportation, employment services, career planning, things like that, waiver nursing, specialized medical equipment, money management, assistive technology. So there's a list of things, sir, that are covered by the level 1 waiver, but there are limits on how much funding is available to you, which is going to be a problem for some people, for a lot of people actually. which is why most people prefer the individual options waiver. And I'm sorry that I answered your question earlier in the presentation. I was talking about a completely different thing. I was talking about the Ohio Eligibility Determination Instrument. That's what I meant. I'm sorry. But I think we cleared it up. So I'm sorry. I'm not used to doing these presentations in public. It's been like 2 years. I'm used to doing everything on Zoom. It's weird.
Do you have Zoom presentations?
Yes,
Oh, yeah. Great
You do?
stuff.
I can. Yeah.
We're on DRO.
Do you know what the eligibility factors do they look for in the CODI assessment once you turn 16?
So that's the COEDI.
Yeah.
So that's what I thought you were talking about earlier. I just got the acronyms mixed up. Ooh man, it's been a while since I've looked at that. So the COEDI, maybe you know.
I don't know off the top of my head, but.
I don't know that I can give you a good answer off the
I hate
top
to
of my
be a
head. But there's the
disappointment.
COEDI, which is for kids within a certain.
It's from
It-
younger to 16 and
I think it's age 16, and then once you hit age 16, then you do the OEDI, which that's what I thought you were talking about. So there's different criteria, and that's going to evaluate are you eligible for county DD board services, that's what I thought we were talking about earlier. That's kind of separate from what we've been talking about today, which is the waiver waiting list part of the system. So we have information available on our website, ma'am, about OEDs and COEDs.
Does your organization have speakers that will go to some of these support groups and give talks?
Reach out to us, yes.
Okay. Yeah, I'll do it.
I've been holding this microphone and my arm is falling asleep.
I need a microphone, I think is.
I'm not a loud person, so I think that I do.
Oh, you do,
Yeah,
that's right. You said that earlier.
you're on Facebook Live, by the way.
I am.
Yes, you are.
Hi, Facebook.
So you'll be posted all over my Facebook page. And
Well, I hope people watch the whole presentation. I just gave some inaccurate information, which I think is corrected.
Okay.
My brain was going off in a different direction.
so my SSA was actually watching you, so.
But
Are you done with the PowerPoint?
I think we're done with the PowerPoint. So thank you everyone for listening. Thank you for the really good questions. Disability Rights Ohio. Our information is in the PowerPoint. I think you have copies.
So on the PowerPoints, what I'll do is I'll convert them to PDF and upload them to the ARC website under resources. Okay, so I'll get that done as
Thank
soon
you,
as I
everyone.
can.
It was nice talking to you. Nice meeting you all. Thank you.